We're gonna do beautiful Elizabeth's lips here. She's got a great shape already, so we're not gonna do a lot of shaping. This is more just for volumes. We're gonna do some lift through here, and then also down through here, creating the two pillows here on either side. So we're just gonna get you to open just a touch here. Notice I don't go right to the corner. That's for two reasons. One, you have an artery sitting very close to that corner. And the other reason is when we go too close to the corners of the mouth, you can create that line that a lot of people get here when they do lip filler. So we want to avoid that. And there's no need to go to the corner because the natural shape of the lip is to taper down into the corner of the mouth. I'm injecting, I like using a vertical technique like this, just to, you'll see I'm pulling the lip up and giving it a bit of height, just to create that pout in the middle. Create that little pillow there and then taper it out to the edges, and again, not right to the corner of the mouth. And it is a little bit swollen right now just because of the needle pokes. Typically most of that swelling is going to settle down in the first 24 to 48 hours, and then the rest of it might take a week, 10 days for it to kind of settle out. And when we do the lip, we're looking at a couple of things. One, the top should never be bigger than the bottom. That's not an anatomically correct way of doing it. And then what we're looking at is the space between the nose and the upper lip and the lower lip and the chin. So we want to keep that in proportion. And I always like to give a nice vigorous kind of massage into the lip in particular. That avoids any bumpiness and lumps that might form. And in the lip, I don't like to use a very thick filler. Some people will, but your risk of getting encapsulation of the filler or lumps in the filler goes up the thicker the filler is usually, and also the more cross-linked variants of the filler will do that as well. So I stay away from the really, really thick fillers. I will go to a medium density filler at most. And we're done.
See, beautiful. Let's see a little closer. Ooh, I love it. How does it feel? Good?
Feels great.
Feels great. You look amazing.